Gentlelady yields back and now recognize the gentleman from Pennsylvania, Dr. Joyce, for his 5 minutes of questioning.
Thank you, Mr. Chairman, and thank you for including my legislation, H.R. 1703, the Choices for Increased Mobility Act, in this hearing. This is common sense legislation. It would give greater access to Medicare beneficiaries to titanium and to carbon fiber wheelchairs. There is one key word in this legislation, and that is choice. This bill allows Medicare patients the opportunity to decide whether a titanium or a carbon fiber wheelchair is the right choice for them. And if it is, then patients with Medicare B have the ability to pay out of pocket for wheelchair upgrades if they so choose. Mr. Ryan, with your background, can you speak to some of the benefits that these lighter weight wheelchairs will offer for those with disabilities?
Certainly, thank you. These patients who are using these type of wheelchairs are not just a broken leg. These are patients with serious diseases, spinal cord disease, and they ambulate on their own the best they can if they have the ability. And just the wear and tear on them, on their shoulders, on their arms, trying to get around and be about and lead a mobile life is just, it's unfair. Other insurances cover this. We haven't gotten Medicare to cover it yet, but the ability to the patient, if they have the means to at least pay the upgrade amount, makes perfect sense. And that is the way it had been in Medicare previously, but through sub-regulation, they made a change, and it's no longer in effect.
You bring out a great point. That is previously what Medicare patients had the capabilities of having, to have a lightweight wheelchair. And this legislation, once again, will provide that for the patients. Thank you for those statements. I urge all of my colleagues to support this common sense, zero-cost measure, which passed unanimously out of this committee last Congress, so that it may be signed into law. I would now like to turn to H.R. 5269, the Results Act. As a doctor, I know firsthand that accurate diagnostic testing is critical for the precise patient care. And that is why I strongly support the Results Act to improve patient access to these necessary services. This is bipartisan legislation, and it provides for stability, and it provides for predictability, and ensures that CMS has a comprehensive cost data for the market-based Medicare payment structure that was originally intended under PAMA for clinical laboratory services. Since the passage of PAMA, we have seen drastic cuts in reimbursement for lab tests, with cuts as high as 30% from previous rates. These cuts across the board impact testing for everything from a skin biopsy to a complete blood count. This under-reimbursement is a dire threat to access for seniors across our country, and there are more cuts slated to occur if we in Congress fail to act. The payments reforms in the Results Act has strong support from a diverse coalition that includes doctors, laboratories, hospitals, and diagnostic manufacturer organizations. I urge all of my colleagues to support this legislation. Ms. Van Meter, thank you for your testimony and your leadership on this bill in building such broad consensus. I would also like to thank Representative Hudson for his leadership on this legislation. I urge the committee to advance the reforms of the Results Act and provide the relief for compounding payment cuts. Ms. Van Meter, can you speak briefly to the impact that these sustained cuts will have on access?
Thank you, Dr. Joyce, for your question. Yes, we are tremendously concerned that these sustained cuts in an unstable payment system can lead to longer turnaround time for patients to get the results they deserve, to have test menus curtailed for those laboratories that focused on the most common routine tests that are essential to everyday care. Those tests disproportionately get cut. We worry about the viability of those laboratories. And then there is innovation. Innovation is tremendously important in diagnostics to help reduce costs overall and to drive—
And you and I recognize that that innovation is the cornerstone of American medicine. Thank you. I would also be remiss if I didn't mention the compounding cuts and underpayments under the Medicare physician fee schedule that have continued to negatively impact seniors' access to their doctors and have forced more consolidation and even higher costs in our healthcare system. I have also become very concerned over the utilization of tools like AI going beyond the already onerous prior authorization process in both Medicare Advantage and Part D, delaying and restricting necessary care. I look forward to working with my colleagues to address these pressing issues in a bipartisan process. And with that, my time has expired and I yield back.
Gentlemen,